While others may live a full life, many people's lives are cut short before the later stages of living begins. This is a picture of my grandma. Unfortunately, she passed away before she got to her 70s of terminal brain cancer. Watching someone progress through the stages of death is not something most people want to ever see, but will most likely happen at some point down the road. Although I have seen the process of death through my own personal experience, this class has given me a better idea and a broader perspective of the topic. As I previously mentioned, no one lives forever, but due to the improvements in public health, the life expectancy, otherwise called longevity, is increasing. There are many different factors that contribute to longevity, which include one's hereditary makeup, gender, race and ethnicity, diseases, physical activity, lifestyle choices, environment, and social class or status. As we age, our bodies go through processes of change. The picture to the right indicates different physical appearances as age increases. The other picture on the left is actually a picture of my grandma's hand on top of my cousin's. As you can see, the differences in appearance are easy to identify. These are changes in the integumentary system. Also, my grandmother's hands have a different tint of color and looks a little blue. This is due to poor blood circulation as people age. Most elders also feel more cold than younger people usually do, and other physical changes that could occur consist of musculoskeletal changes, cardiovascular, immune, respiratory, digestive, and nervous system changes. Because our bodies are constantly changing as we age, it's important that the elderly continue to participate in physical activity for many crucial benefits. Some of these benefits include maintaining bone mass because with age, bones become weaker and less dense, which makes elders more susceptible to fractures. Other benefits include increasing endurance, aerobic capacity, reducing body fat, increasing muscle strength, balance, and flexibility, as well as improving the overall well-being and cognitive function of an elder. While there are many precautions one can take to prevent the occurrence of many diseases, there's one disease that more than 5 million Americans are living with, and that would be Alzheimer's. Alzheimer's is the most common cause of dementia among older people, and it's a progressive brain disease that slowly destroys memory. When it becomes advanced, it prevents people from performing the simplest tasks. Although there's no cure yet, there's a lot that can be done to manage the symptoms. As we learned from our speaker, most elders are taking 6 to 8 medications on average at one time, which is preferred to polypharmacy. Taking this many medications at a time can be overwhelming and hard to manage as one ages. Surprisingly, not being able to keep track of medications is not one of the major issues when dealing with elderly. The biggest issues include enhanced drug effect, drug-to-drug interaction, and non-adherence to medications. But if you are a senior that does need a little extra assistance with medication and assistance with everyday tasks, a good option for you would be an assisted living home. Assisted living homes are often confused with nursing homes, but are entirely different. They help you with tasks such as dressing, bathing, toileting, and eating. Assisted living homes cost less than a nursing home because they do not need full-time nursing care. The average cost per month for an assisted living is around $3,500. On the other hand, nursing homes have a skilled nursing staff to assist residents with anything and everything. Nursing homes are ideal for elderly who simply cannot take care of themselves and require continual nursing care. Because of the skilled nursing available at all times, the cost of living in a semi-private nursing home room ranges around $6,000 a month. As you can see, long-term care is not cheap. So how do the elderly afford it? As you can see on the chart on the right, the majority of seniors use Medicare, which is a government insurance program for the elderly aged 65 and older. It only covers medically necessary care and focuses on improving health, such as therapy. Because of high costs, seniors then turn to Medicaid, which helps people with low income. What I thought was interesting was that to be eligible for Medicaid, Seniors have to almost use up all their savings, liquidate their assets, and sign over their house before Medicaid can cover any long-term stays. The issue of funding really interests me, yet makes me nervous for what is to come in the next 10 years with the baby boomer generation and everything else that's changing. So as a future healthcare administrator, it is important to know the changes and processes that occur as one ages, even if I may not be dealing with patients directly. It is important to know this information to be able to explain to families and caregivers as well. I actually do want to work as administrator in some type of long-term facility. Therefore, the information I have learned in this class can help me out tremendously as I work my way up. Hopefully 60 plus years down the road, I can look back at my life and give it a thumbs up. But until then, I'm going to enjoy the present because who knows what the future holds.